Hi guys, today with us Dr. Abhishek is there. He is doing his DM neuropathology residency in NIMHANS. So let's ask about him, why he chose this DM neuropath in NIMHANS, when he got to know, and what is his experiences and what all different exams he has given. So sir, please introduce yourself.
So thank you, Dr. Keerthy, to let me share this on this platform. So I am Dr. Abhishek Chaudhary. I did my MBBS in West Bengal in 2011. I passed MBBS in 2011, and thereafter I did MD in IPGMR Calcutta in 2012-2015. So basically, you can see I passed MD in 2015, and now it's 2022. I got into this DM course of neuropathology in NIMHANS in 2021. So it has been quite a few years since I did the MD, and quite a few places I have worked in, and I can share all those experiences with you, so as to why I went through this process of getting into DM, getting into the pain of studying once more. I was practicing quite well actually. So I'll let you know all this.
So sir has finished his MD in 2015 and then he started working as an associate prof for almost 6 years. Then he decided to clear he wanted to do a DM. So then he started preparing. So obviously after 6 years of losing the touch, I don't know how he managed to get a good rank and get a DM, and he did so well in his various fellowships as well, right?
Yeah. So the thing is, actually, I wanted to do some fellowship or some training after MD in 2015. That time I couldn't crack them, to be fair. And in 2016 I started working actually as an AP in private college. So after that I continued teaching students like almost 2-3 years. From 2018 I started working in full-time diagnostics. So the problem I faced gradually, that I was losing touch, as it's normal. So in 2020 sessions, all the exams that are there in all of India, the fellowships and the DMs, I started appearing in them.
Then sir, how you got to know that there are different fellowship exams? Because those days we have not much of a knowledge. Now also we don't know. So how you got to know that there are fellowships, there are DM exams, and how to prepare about them? Now that we have Facebook, it's easy approachable, right? So how you got to know there are various fellowships and how you prepared? And that too after 6 years of doing your MD.
So thing is, all of you will be having friends who have gone into various fellowships, and one or two friends who have gone into DMs, and you may be knowing someone who has got into some college. So you will be knowing already that okay, this college, suppose Tata main hospital, Tata Memorial Center, they have fellowships. Maybe you all know that. AIMS gives DM seats, you all know that. But to know the whole spectrum, how many institutes in India are giving the different seats in different subjects, simply go to the websites of those institutes, all the renowned institutes that you know. I just went through them and found out the previous year's prospectus. What are the seats they are offering and what are the fellowships they are offering. So by this I got to know that several institutes are offering several fellowships. I went across to each one of them to appear in the exams, and if you remember 2020 was COVID time. So I went through that COVID time to appear in the exams. So I think that is what made me get into these ranks in the next year.
And my next question is, so many people ask, is it necessary to do a fellowship nowadays post MD or a DM?
Okay, I'll tell you that. So as I told you, I passed in 2015. So at that time, after passing, I got the job of an assistant professor, and I got, as you will be also getting several offers from private labs to work. Some of you will be getting into government jobs, in teaching on medical colleges, also in general duty medical officers, specialist medical officers, all of them are there. Some PSU jobs will be there like NTPC, Coal India, all of these are there. But the thing is, after you get into these jobs, you'll find that there are pros and cons in every job. Okay, you need to set your priorities right. So in some job you feel like you are not getting enough money. In some job you will feel like you are not getting that academic boost for your brain what you studied in 3 years of MD. So you need to prioritize. If you are okay with just money and you are fine with forgetting things, that's okay. Then you may work as a specialist medical officer somewhere, or stuff like NTPC, or those PSUs or central government jobs like airlines. So that may satisfy you there. But if you still want that your academic part has to be slightly better, or you want to continue what you learned in your MD, like cytopath, histopath, just rather than doing your events too, so you will want to do something. Okay. And in private labs, in corporate labs, what you will feel is, if some of you are working already, you will feel that that's the place where they want something from you. It's a scene of demand and supply. If you are giving something, then you will be kept there. If somebody else is giving something that is more than you, then you better buck up and provide something extra. So for all those people who are working in private labs, who have just entered there, the environment is nice, there is no such patient burden like government jobs, you'll be liking them nicely. But you remember that you have to keep something special up your sleeve, otherwise tough time might come.
So he wants to tell you are replaceable.
That's a better way of putting it.
Okay, I understood. So now let's tell something about NIMHANS, as you are doing DM neuropath there. So what this institute has to offer, what is the fees, what is the stipend, duration of the course, different courses NIMHANS offer for an MD post grad.
Okay, so now we are talking specifically about NIMHANS. So MD, after MD, NIMHANS gives you option of fellowships and DM. When I applied for DM, NIMHANS used to take the exam for DM as well as fellowships. Now it has become INI, Institute of National Importance, common exam. So you will be appearing for the exam, including AIMS, PGI, and NIMHANS, JIPMER, all of them. So now if you want to appear for the DM, you have to go through the INI SS. If you want to appear for the fellowship, there are 2 fellowship seats right now. So if you want to appear for the fellowship, you have to go for the independent exam conducted by NIMHANS. Okay. Now coming to the stipend. At this age, after passing MD, most of you are at least 28-30, if I guess. So that income thing is also important. You need to earn. Central institutes are good in that aspect. So they'll pay you at the scale of Central Institute. You will be earning something around 1 to 1.2 lakhs per month. So I think that will be at least, Bangalore is a costly city, fine, but it will be okay for you. It won't make a hole in your pocket, so it will be okay for you. And regarding accommodation, they give you accommodation. You can stay outside also, so that's your choice.
Fees?
Fees, during admission they take some admission fees. I think it was around 80. It includes the examination fees also, and per year I think tuition fees is around 50,000. So yeah, that's it.
Then academics wise,
Okay,
workload wise.
So NIMHANS is an institute which is recognized throughout the world, if I can say, and neuro related stuff like PhD in related neurosciences and applied neurosciences, and every subject that we learnt in MBBS, such as physiology, anatomy, biochemistry, anesthesia, everything has got a neuro touch in NIMHANS. So you are getting departments like neuroanatomy, neurophysiology, neurochemistry, neurovirology, and I can tell you the facilities and infrastructure here are top notch. The things that we are reading in the books, that okay, this test is done after this, and after this we advise this, that top end of the advice is completed here. Okay, so samples from all over the country, which are nerve, muscle, brain tumor biopsies, epilepsy samples, all of them come to NIMHANS. Okay, so this is an apex center of neurosciences, and if you are interested in neurosciences, this is the place in India.
Then people usually tell there is only one seat, ma'am. Anta. So what is your answer for that?
Okay.
Only one seat is there now.
So, thing is, I used to think same. Don't take me that okay, I have ranked in that single seat, so I am some top. It's not like that. Thing is, you need to focus on that. Simple.
Yeah. That means you want one seat, that is for you. That's it. Therefore,
Exactly.
there is
You
one
don't
seat.
need two seats. You need
Yeah.
only one seat. And in every exam, wherever you appear, you give your best shot, isn't it? Nobody appears in an exam to come second. They always try to get the best result out of it.
So few people ask, like, you might be so intelligent in your MBBS and MD days, that's why you are able to crack and go to NIMHANS. Is it?
So I can tell you one thing. I was a pretty mediocre, average student in MBBS, MD also. It's not like that I am that padaku kind of guy who studies all of the time. It's not like that. So what I want to focus is you have to get adjusted to the pattern of the exam. See, I got into this course in 2021, but I appeared for all these exams in 2020. Okay, I got waiting lists, missed the ranks by one or two places, but that gave me that pattern recognition of all these exams, and
So
that is
what
important.
topics are asked, where to focus?
Okay,
right?
so all these things will be helping you out in our classes, which we'll be taking. So all those particular topics, which areas you need to focus on. See, it's not about studying lot; it's about studying smart. So you have to be smart. You have to pinpoint your answers, and you will crack the exam.
So it doesn't matter how are you in your MBBS or MD, past is
Right.
past. So now what you do today is important to crack an any exam, right?
Exactly. And there are so many exams, so many fellowship exams, so many DM exams throughout the country. Trust me, you will crack any of them. You have to just be perseverant.
So sir has decided to join PG Path tutorial classes, and he will be joining us for the NEET SS coaching as well. So he will guide you related to DM neuropath and in general NEET SS also, and various fellowships he has appeared like JIPMER.
Yeah, so I have
SGPGI.
appeared in JIPMER. I got a rank there, and then NIMHANS came about. So since JIPMER was a fellowship exam, I sacrificed the fellowship post and took DM in NIMHANS. So I'll be covering the neuropath part in PG Path classes with Dr.Keerthy, and Oncopath NEET SS. They ask a lot of neuro questions.
Yeah, this time I think 8 to 10 questions
Yeah,
came.
so be prepared. Neuro questions will come, and that's a part that we neglect in MD days. I know that.
So last question,
Yeah.
why you want to teach students? We
Okay.
both share a common passion.
Yeah.
So we'll be discussing why, because we personally feel there was nobody to guide us.
So thing is, I searched it the hard way. I learned it the hard way. I went through every website. I failed in several exams during entrances. Waiting list, waiting list, waiting list. It's not a nice feeling. If you are trying something new and still you are failing, it's not a nice feeling. So to know the pattern, I gave the exams. Okay, and what I have got through all of those exams, I'll teach you. I'll guide you, and I think that guidance is required for all these exams. Suddenly you appear for one exam and you suddenly find that okay, I have read so much, but these questions are totally different. Okay, so that path is required, and we are here to help you out.
So hope you liked our video, and any doubts please let us know in the comment section, so we'll be answering or we'll making a future video on that. So now we are there to help you and guide you in your post MD journey. So hope you all of us join with us, and we'll help you out in finding out your dream branch or DM or fellowship, whatever. And last question, sir, if somebody has to choose a fellowship or a DM, what do you advise them?
Okay, so it depends on the stage of your life you are in. If you don't have much time, you want to do it fast, like 1 year you want to do something special and you want to get into the job again. So the job, I mean private job. If you are appearing for a government medical college job, you be sure that along with you somebody will be competing with a DM degree. So in that case, the fellowship will have slightly a lesser advantage. The DM will have a greater advantage. But if you are working in corporate and you don't have much time to spare, the fellowship will be okay. It depends on your economic condition also, how much money you need, and because let me get this straight, money is important at this stage of the life. Money, time, your family will be there. Maybe you'll have to move to a new city. So all these things you have to consider. It's not like MBBS days where you just pack your bags and go to the college.
Yeah, I can
It's not
understand.
like that.
He's from Kolkata, so he shifted from Kolkata to Bangalore. Obviously, it won't be that
So,
easy
yeah,
for him.
it's difficult, and just you have to prioritize and make your family understand. The family should help you. The support is very much essential. So all those things you need to consider. But in any government medical college exam interviews for a job, per se, DM will have, because it's a degree, it will have a greater.
So, in
Enjoy.
your opinion, DM is always better than fellowship. But if you have a less time, go for fellowship.
Yeah, sure.
Okay. Thank you very much, sir, for sparing his time and clearing your doubts.
Anytime, and
Hope to
we'll
see
you
you
in the class.
in the classes. Thank you.